The problem we are trying to address is suicide in Montana, where the rate has been one of the highest in the nation for several decades. Stigma is believed to be one of the biggest barriers to help seeking, and we are trying to address stigma in communities by using community-based theater to encourage help seeking and open discussion of the problem. Our short-term goals are to educate small groups of youth in Montana's rural frontier, and our long-term goal is to increase the usage of professional counseling by youth at risk. The innovation of our program is that it draws on performance studies and peer-to-peer education through discursive approaches, using youth-led experiences and narratives to educate adults and peers in a community. It's based on the evidence that research on suicide prevention shows that top-down models of education are not effective. Simply training people about signs and symptoms of suicide will not address the deeply held stigma and cultural barriers to open discussion and dialogue about suicidal ideation, barriers to professional counseling, and barriers to open discussion about suicide ideation and suicide risk and suicide completion. In fact, there's evidence that shows that narrative empowerment education and peer-to-peer communication of experiences and narrative dialogue can actually address many public health risks, and we are using community-based theater in this approach. By identifying the barriers to help seeking, we may then be able to create better interventions to address the untreated risk around suicide. The expected outcomes are to reduce stigma using the Stigma Against Help-Seeking Scale by Vogel et al. From 2006 and Batterham's Stigma of Suicide Scale. We're hoping to collect data in a randomized control trial using videotapes of the theater interventions edited into shorter documentary formats as our treatment, and comparing changes in perceived stigma to control groups randomly assigned, using college students first and then switching to high school students as we gain evidence. The guidance from experts that we seek are to learn how to access greater numbers of participants for our study, as well as to identify which scales to use in addition to the ones we've already selected. We've also encountered many design challenges in our study, such as figuring out whether or not we can afford to lose the live interactive role-playing through just the video use, or whether we should pursue online motion interaction formats to create role-playing online. We believe that online education has the chance of reaching more remote, isolated communities, such as tribal communities in North America, and maybe internationally. We'd like to ask how can or should we replicate the interactive role modeling in an online format, and how might we expand the community-based theater program to other communities nationally and globally? And finally, our ask to the audience is, we believe that creating a multimedia educational tool for training of trainers to implement similar projects to Let's Talk, our community-based theater intervention in other communities, is the way to go forward. And we're hoping that we can achieve financial and human assistance in order to complete the editing and production and dissemination of a tool that we already have filmed and is underway. So to find out more about our program, please visit www.GHEF.org. That's www.GHEF for Global Health Equity Foundation.org. Thank you so much for listening, and I look forward to talking to you in person.